From KARK4 and Fox 16, this is a special report. Here's Mitch McCoy.
Hello and good afternoon. Here from Studio B in Little Rock, I'm Mitch McCoy. The Arkansas Department of Health just a few minutes ago announced the latest COVID-19 case report here in the state, and I want to get to what those numbers are. It's a record-setting day for the fourth day in a row. Active cases up now to nearly 51,000. The daily case count over the last 24 hours, 8,434. Hospitalizations are up 41 at 933, and sadly 20 more people have died from the coronavirus. That brings us to a total of 9,298. There has been a rapid ploy across the state to get people tested for COVID-19. You're looking live right now at Arkansas Children's Hospital, where we have heard lines have been growing there throughout the day. We've also heard about lines at Baptist Health, also UAMS, as more and more people get tested for the coronavirus. And it's worth noting, we just learned a few moments ago, according to the superintendent of the Little Rock School District, school has been, will go virtual Monday and Tuesday. If you recall, school was virtual the last 2 days this week, today and yesterday. The school district now expanding that to Monday and Tuesday, as well as there is just an extraordinary number of COVID-19 cases being reported across the state. And again, if you're just joining us, over the last 24 hours, we're now stacking on 8,434 new COVID-19 cases. I want to bring in Dr. Jennifer Dillaha from the Arkansas Department of Health. Dr. Dillaha, thank you for joining us this afternoon.
Well, thank you for having me.
We really appreciate it. I know that the circumstances surrounding this are just really troubling. I mean, I think about the last time we spoke, and I want to say it was right around Christmas time, and we were not talking about new cases at the level that we are today. Just what is your overall take on today's new case count and how quickly hospitalizations are stacking up?
Well, we're in the midst of a very steep increase in the number of cases, a really significant surge of COVID-19 that is due to the Omicron variant. What's happening in Arkansas is happening in other states and other countries around the world.
So when we look at the total case count, and then we also look at the hospitalizations, what are those numbers telling you from your perspective?
Well, we are having a record number of cases right now. Fortunately, we're not having a record number of hospitalizations. And the reason for that is that the Omicron variant appears to cause milder disease compared to the Delta variant that we had previously. However, COVID-19 is not a benign disease, and many people are still ending up in the hospital, even though the proportion is smaller. But yet, the absolute numbers are so great that we're having great increases in the number of people in the hospital. This is of concern to us because many hospital workers are also getting COVID. So while we have a healthcare provider shortage already in our state, we are now seeing large numbers of hospital personnel who are having to isolate because they have COVID-19 or they're having to quarantine. So this is putting a tremendous stress on our healthcare providers, our hospital systems, and our clinics.
So speaking of hospitalizations and in clinics, the number of hospitalizations, 933, we are rapidly getting to the January total number of hospitalizations. I mean, we're looking at a 105% increase in hospitalizations from this time last month. So the treatments that are available Can you give us a status report on some of the antibodies that's available, and then also those pills that we've been hearing a lot about to help the very sick?
Sure. So we do have what we call monoclonal antibodies available to treat COVID-19. Unfortunately, the ones we were using to treat the Delta variant, most of them do not work against the Omicron variant. Just one of them does. And this particular monoclonal antibody is in very high demand and very short supply around the country. So we don't have nearly enough doses that we need in Arkansas to treat people. So it's being reserved only for people who are at highest risk for severe illness, meaning people who are 65 and older, have underlying chronic health conditions, or weakened immune systems. We also have available 2 new medications that have been authorized by the FDA. These are oral medication pills that people take, and they are called antivirals. They work to keep the virus from replicating once you're infected. And that's an important tool for us to help people who are at risk for severe illness if they were to get infected. They are also in high demand, and the supply is not great. They're just now ramping up the production of those pills, so the supply is constricted. So we do have doses available in Arkansas, but not nearly enough. There is one more monoclonal antibody that can be given in Arkansas, and that is one that is given preventatively for people who have severely weakened immune systems. They aren't likely to mount immunity on their own to the vaccine, and they are at risk for severe illness. So this monoclonal antibody is preventive, and that's also available through certain clinics and so forth, such as cancer clinics and other healthcare locations where those types of patients are most frequently seen, and we do have a fairly good supply of that preventive antibody.
But when it comes to, I guess, that pill from Pfizer and then Merck, does the state have enough to deal with how fast the hospitalizations are increasing?
No, we do not have enough. We have one of them is called Paxlovid. We were allocated less than 500 doses this last allocation. That's not nearly enough. Of course, we're in the same boat as all other states. So we're having to provide it to clinics and hospitals around the state so that they can provide it to the patients that are needed. It's also available. It must be written by a doctor, has to write a prescription for it. Mm-hmm. So it's also available in some pharmacies, Walmart pharmacies around the state, not all Walmart pharmacies, but some. So we're trying to get it widely out there, although there's not enough doses available at any one location.
And then at the end of the day, you have to find somebody to administer it, and you know, at this point, I'm sure it's easy to find that, but you also have a large number of hospital personnel who are going into quarantine themselves. So I mean, you're facing multiple battles here at the same time, it sounds like.
It's true. You know, all hospital systems are struggling right now with staff who are out, including the Arkansas Department of Health local health units. We have many staff out, clinics, businesses. You know, we all need to do our part to do whatever we can to lessen the spread of COVID-19. And that important step for the time being is wearing a mask and practicing social distancing, and not go places right now that you don't have to go.
Dr. Jennifer Dillaha from the Arkansas Department of Health joining us live on all of our digital platforms. Dr. Dillaha, when we look at the record number of hospitalizations from last year, last year, it'd be January 2020 into February, we saw more than 1,500, correct me if I'm wrong, hospitalizations in the state. we're quickly approaching that. I mean, just on Tuesday, there were 700 or so hospitalizations in Arkansas, now 933. Within the next week, maybe week and a half, we could approach that 1,500 mark. Where is that stress line right now on our hospitals? We heard the governor talk a lot about the surge plan. Are hospitals going into that surge plan yet? And if not, when will we see that? Because with today's case count, the hospitalizations are only going to be increasing.
Sure. Well, hospitals have been through two large surges already. They know what to do. The issue is not the physical beds or the physical ventilators that people will need. It's the people to take care of them. So we are taking steps in Arkansas to support the hospitals, and hospitals are dealing with their own personnel issues by reducing things like elective surgeries and moving staff from outpatient clinics to inpatient to help take care of patients who are admitted to the hospital. So they know how to move their staff and personnel around. And then it may be necessary to hire more staff, and those plans are in the work also. And then there's going to be a need also for people to take steps themselves to stay out of the hospital. And so for that reason, I'm strongly encouraging people to get the flu vaccine and get the COVID vaccine if they haven't had them already, because we know flu puts a lot of people in the hospital every year, and we have a high level of flu right now.
Yeah, Dr. Dillaha, this is a live picture, Arkansas Children's, where they're testing right now. We've seen a record number of people being tested for the coronavirus at numerous hospitals across the area. For people who are trying to get vaccinated, people maybe trying to get their second vaccine, maybe even people who are trying to get the booster, have you heard of people being turned away because of the record number of people needing to get tested? Have you heard anything like that?
I have not at this point heard that people who want to get vaccinated are not able to get vaccinated, but I'm sure every clinic that provides vaccine is working to make that possible. It's important for everyone who's recommended to get a vaccine to get vaccinated. Children 5 years of age and older are recommended to get vaccinated. Right now, almost a quarter of the new cases are among children, and children are ending up in the hospital. And we want to be able to keep the schools open. So it's going to be important for the children in our communities around the state to get vaccinated.
What is the situation with children being hospitalized? There was a report out today. I'm not sure if you have seen it yet. The Associated Press saying that across the country, we are at an all-time high for children being hospitalized with the coronavirus.
Well, we saw in other countries that got the Omicron variant first, they had a decrease in the percentage of adults going in the hospital and an increase in the percentage of children going in the hospital. And we anticipate that we will be similar. My concern in Arkansas, of course, is we have just one children's hospital. We do have a campus in Northwest Arkansas, but they don't have the intensive care available in Central Arkansas. So it's going to be really important for us to do whatever we can to take care of our children. Of course, children under 5 cannot be vaccinated. So it's going to be important for everyone around them to protect them by getting vaccinated themselves to decrease the likelihood that they could transmit it to the unvaccinated children.
Earlier this week, there were 11 patients across Children's Hospital system, 1 in ICU. When you say that there is concern about that number increasing, are there projections? Are you guys looking at data that shows that Children's Hospital could be overwhelmed. We heard those words from Dr. Jose Romero, of course, the health secretary, earlier this week. You know, based off of the data, it shows that hospitalizations are increasing, but it seems like the pressure isn't at Children's just yet.
Well, of course, Children's has their other illnesses they're taking care of children for, other respiratory viruses such as RSV, human metapneumovirus, influenza. So all of that taken together could really put a stress on our children's hospital along with COVID. And we just really need to help protect our resources so that the children who really need care can get it.
And I'm sure Children's is talking with other hospitals across the state in terms of contingency plans in case they get to a point to where they cannot take patients. Can you fill us in on those conversations and what you've heard?
Well, I'm not part of those conversations. I know in the past, often for the older children, the adolescents, sometimes other hospitals are able to take the older children. There's few hospitals that can handle the little children, especially if they need to be ventilated. So that's one strategy that Children's has used in the past.
Okay. Dr. Dillaha, I know I'm going to have to wrap up here, and just one or two more questions, I promise. I was scrolling through social media actually this morning, and I saw a video on social media from last night, and it was at a bar in downtown Little Rock, and people were shoulder to shoulder. No one was wearing a mask. You know, earlier that day, there was another record of COVID cases broken. Do people just not care? Would be my question. Because at what point does the message just not work?
Well, I think there's a couple of things going on. One is that people have a hard time sorting through accurate information from information that's not real or false. And it's hard for people to understand the situation right now if they're not following the news closely as well. So people may be making decisions that they think are right for themselves, but they're not well informed, and they're making uninformed decisions. So that's one of our concerns. The other concern too is that people are tired of the pandemic and they just want to get on with their lives. And of course, I want that too, but now is not the time to act as if the pandemic were not here. We really need to pull together in Arkansas to help one another, to support our hospitals and our healthcare professionals. And the best way to do it is to do our part to prevent the spread of COVID-19. Get vaccinated, wear a mask, practice social distancing, and avoid going places where it's crowded and the spread of COVID-19 could be enhanced.
Dr. Jennifer Dillaha from the Arkansas Department of Health giving us an update this afternoon on the growing number of coronavirus cases here in the state of Arkansas. Again, if you're just joining us, 8,434 new cases, 50,000 currently active in the state. Dr. Dillaha, I want to point out last week, Dr. Jose Romero, correct me if I'm wrong, Thursday or Friday during the briefing, said that the Department of Health is expecting the caseload to double, and here we are with 8,434 new COVID cases today. Are you guys expecting that number, 8,434, to double by this time next week, or do you expect it to start going down?
It could happen that it would double next week. I do not have a good prediction for when we will hit our peak and turn it around. We're not there yet, and we do not have signs of showing that we are near it yet.
At this point, you're expecting the number to just increase?
At this point in time, yes.
All right, Dr. Jennifer Dillaha from the Arkansas Department of Health. We appreciate your expertise and your guidance, your candidness, and just trying to give us as much information as you possibly can with what we know about this rapidly changing virus and everything that the state of Arkansas is doing. Thank you for joining us. This has been a special report from KARK and Fox 16. We are live in about 7 minutes on KARK 4 News at 4, and we'll have much more on this breaking news as Arkansas sets another record day of COVID cases for the 4th day in a row. I'm Mitch McCoy here in Little Rock.